Why do some elderly adults have trouble swallowing? In this video, we'll explore the reasons why some elderly adults have trouble swallowing, also known as dysphagia. From age-related physiological changes to underlying health conditions, understanding the factors contributing to swallowing difficulties is crucial for effective management and improved quality of life for seniors. Understanding dysphagia in the elderly. Dysphagia, a medical term for swallowing difficulties, often affects elderly adults and can significantly impact their quality of life. Understanding the swallowing process, the types of dysphagia, and common causes is critical for those experiencing this condition or caring for someone who does. Aging in the swallowing process. As you age, the muscles and nerves that assist in the swallowing process may weaken. This natural age-related change can make it more challenging for older people to swallow food effectively. Health conditions like stroke, Parkinson's disease, Alzheimer's disease, and amyotrophic lateral sclerosis, ALS, common in the aging population, can further complicate the ability to swallow and increase the risk of dysphagia. Types of dysphagia. Oropharyngeal dysphagia. This type involves problems with the throat muscles and nerves. It's often seen in neurological disorders such as Parkinson's disease or after a stroke. Esophageal dysphagia. This pertains to the esophagus, where food might feel stuck due to an esophageal stricture, Schatzky ring, achalasia, or esophageal cancer. Common causes of swallowing disorders. Neurological conditions, stroke, Parkinson's disease, multiple sclerosis, and myasthenia gravis affect the nervous system, complicating the swallowing process. Esophageal changes, conditions like gastroesophageal reflux disease, GERD, esophagitis, and eosinophilic esophagitis can cause inflammation and narrowing. Aging, age-related changes in the strength and coordination of the esophagus and throat muscles can make it difficult for an older person to swallow. Working with a speech-language pathologist or speech therapist is a good idea to manage or improve swallowing function and reduce the risk of complications like aspiration pneumonia or weight loss. Symptoms and diagnosis of trouble swallowing. Identifying symptoms. When an older person begins experiencing trouble swallowing, it's important to identify key dysphagia symptoms. Common signs of dysphagia include coughing or choking when eating or drinking, leading to a risk of pneumonia, regurgitation of food or liquids, possibly indicating gastroesophageal reflux disease, unintended weight loss due to difficulty swallowing or avoiding eating, dehydration or malnutrition, as a result of reduced oral intake, persistent soreness in the throat muscles or chest pain while swallowing. Diagnostic procedures. After noting the initial symptoms, the next step is a thorough diagnosis by a doctor or speech-language pathologist. Procedures that might be recommended: a barium swallow test, modified barium swallow, or a video fluoroscopic swallow study to visually assess how well you swallow food and liquids, a fiber optic endoscopic evaluation through which a tiny camera is guided down the throat to examine swallow function, an esophageal manometry to measure the rhythmic muscle contractions in your esophagus and the coordination of your esophageal muscles with your swallowing process, an endoscopy to look into the throat and esophagus for structural abnormalities, such as esophageal cancer or inflammation due to acid reflux. Management and treatment. Effective management and treatment of swallowing difficulties in elderly adults are essential to improving their quality of life and minimizing potential health risks, such as dehydration and aspiration pneumonia. Medical and surgical treatments. For those with severe swallowing disorders, medical and surgical treatments are often necessary. Healthcare professionals might recommend medications to manage underlying conditions like gastroesophageal reflux disease, GERD, that can contribute to swallowing difficulties. In cases of esophageal dysphagia, surgery may be needed to address physical obstructions or malformations, such as a diverticulum or a malfunctioning esophageal sphincter. In certain neurological conditions like Parkinson's disease or amyotrophic lateral sclerosis, ALS, electrical stimulation provided by speech-language pathologists can help some patients improve their swallow function. A fiber optic endoscopic evaluation may be utilized to closely examine the swallowing process and identify the best intervention. If oral intake remains unsafe, a feeding tube may be considered to ensure adequate nutrition and hydration. This could involve a nasogastric tube for short-term use or a more permanent gastrostomy for long-term needs, especially when risk of aspiration pneumonia is high. Nutrition and dietary adjustments. Dietary modification plays a critical role in managing swallowing problems in the elderly population. Here is a suggested approach: transition to softer foods like mashed potatoes and well-cooked vegetables. Thinning or thickening liquids, depending on the patient's needs, can make them safer to swallow. Avoiding difficult-to-swallow foods, such as popcorn and nuts, will help prevent discomfort or aspiration. In severe cases, seeking out a swallow study from a healthcare professional can provide insights into the most beneficial dietary practices for the individual's specific condition. Preventive measures. Oral care. Regular oral hygiene can help prevent infections, which is often caused by bacteria from the mouth being inhaled into the lungs, a condition known as aspiration pneumonia. Encourage elderly adults to brush their teeth and use mouth rinses to keep their mouths clean, reducing the risk of infections and maintaining a healthy diet. Dry mouth management. Keeping the mouth moist is important for the swallowing process. Staying hydrated by drinking water or sucking on ice can also alleviate dry mouth. Swallowing exercises. A speech-language pathologist can provide swallowing exercises to strengthen throat muscles. Dietary adjustments. Ensuring that the elderly population has access to good options for their diet, such as softer foods or thickened liquids, can aid in preventing dysphagia symptoms from worsening. Supportive therapies and rehabilitation. Speech and language therapist. Engaging with a speech or language therapist can be a good idea to develop personalized strategies that address the specific swallowing problems an older person faces. This might include learning new swallowing techniques or finding different medication to alleviate symptoms. Positioning. Teaching elderly patients the correct way to position themselves when eating, such as sitting upright during meals, can help reduce the risk of dysphagia and minimize the chance of silent aspiration, which can lead to serious health problems. Monitoring progress. Healthcare providers should conduct regular swallow studies to monitor the improvement or progression of the condition. Intervention steps. In severe cases, medical procedures such as the insertion of a feeding tube may become necessary to maintain oral intake. However, this is typically a last resort after other strategies have been exhausted. By adopting a multidisciplinary approach involving healthcare providers, elderly adults with swallowing difficulties can experience an improved ability to swallow and a better overall quality of life. Final thoughts in conclusion. The issue of swallowing difficulties among the elderly is multifaceted, stemming from a combination of age-related changes, medical conditions, and lifestyle factors. While dysphagia can pose significant challenges and increase the risk of complications such as malnutrition and aspiration pneumonia, early recognition and intervention are key to managing the condition effectively. By addressing underlying causes, implementing dietary modifications, and utilizing swallowing therapies, healthcare professionals can help elderly individuals maintain their ability to eat and drink safely. Additionally, family members and caregivers play a vital role in providing support and creating a safe eating environment for their loved ones with dysphagia. With a comprehensive understanding of the factors contributing to swallowing difficulties and a collaborative approach to care, we can empower elderly adults to enjoy a better quality of life and continue to savor the pleasures of dining well into their golden years. Thank you for watching. To read the full article, go to livingyourSeniorLife.com. The link can be found in the video description.